Hi, my name is Francine Viltura, student nurse from the University of San Agustin. Today, I will be performing immediate newborn care, which involves drying the baby on top of her mother's abdomen. This encourages skin-to-skin contact, which is important to maintain the baby's temperature, as well as to enhance the mother and child bonding.
So first and foremost, we need to check the Apgar score of the baby. So the Apgar score is a simple method of quickly assessing the health and vital signs of a newborn after delivery. So there are 5 criteria to be assessed in the Apgar score. First is the appearance, which is the skin color, the pulse or the heart rate, grimace or the response of the baby, activity or muscle tone, and respiration or breathing ability. So Apgar scores that ranges between 0 to 3 are critically low, 4 to 6 are below normal, and 0 to 10 are considered normal. This is to be checked 1 minute after birth and 5 minutes after birth.
So after checking the 1-minute Apgar scoring, we need to provide warmth and safety latching. So first is we position the baby prone on top of their mother's chest and provide skin-to-skin contact. So ma'am, I will be opening your blanket. Um, Then we cover the baby with a sterile towel to remove the amniotic fluid, thus keeping the baby warm. This is the sterile towel. Next is we hold the baby while she is on top of her mother's chest to keep the baby free from injury. Then we wait for the baby to suckle on the nipple. Next is we proceed for the clamping and cutting of the cord. So we need to check the cessation of the pulse at the umbilical cord at least 1 to 3 minutes after delivery. So it's been about 2 minutes. Yeah. Then we measure at least 1 inch above the base of the umbilicus. So this is about 1 inch. Then we clamp the cord with a sterile umbilical clamp. So assuming this is an umbilical clamp, we cut the umbilical cord.
Next is to prepare 1 cc syringe, dry cotton balls, and cotton balls soaked in alcohol. Check the label of the medicines to be injected. Next is to aspire 0.1 ml of vitamin K using a tuberculin syringe. Next is to identify the baby by checking the identification band on the foot. Inject the vitamin K on the lateral aspect of the left thigh and the Hep B vaccine on the lateral aspect of the right thigh after disinfecting the area with sterile cotton balls with alcohol.
So hello everybody, my name is Francine Viltura, a student nurse from the University of San Agustin. So today I will be performing an anthropometric measurement. So an anthropometric measurement is commonly used to indicate the growth and development of infants. This includes their length, weight, and head circumference. So first, I will be measuring the head circumference. Okay. To measure the head circumference, we need to pass the tape around the head to obtain a circumference measurement. Mm-hmm. 27. Then record the head circumference in centimeters. That was 27 centimeters. Next is we measure the chest circumference. Next, we need to feel for the stiffest sternum, where the ribs meet the sternum and the mark. After that, we'll pass the tape around the lower chest so that the mark is at the upper border of the tape. Pakabudlay. Ay, bilat ko. $35. Then record the measurement of the chest circumference in centimeters. And then next is we measure for the length. So we place the measuring tape from the top of the head um, up to the bottom of one of the heels. $42. And lastly, we'll be measuring for the weight of the infant. So we put a lining in the weighing scale and calibrate the scale to 0. Remove the draping or lampen and place the baby in the weighing scale and take note of the weight in kilograms. Move your way. I will be using this as an alternative weighing scale.